Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades and are so proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We really appreciate you all being here with us today. Today's webinar is Clinical Success for Vaginitis HPV Yeast Infection with 40 plus years of herbal mastery with Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience from treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he strictly purchases herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed as Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the formula. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if the disease is not local or if it is chronic. Dr. Jimmy Chang, a widely known figure in traditional Chinese medicine, has been instructing at eLotus for the last 2 years, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulsynergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us today, let me familiarize you with our webinar room. Please set your chat from hosts and panelists to everyone. That way everyone can be part of the conversation. To ask questions during the webinar, use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Testing 1、2、3 1 2 3 Hi guys, it's me again, Jimmy Chan. Today we're gonna talk about something very interesting and very commonly seen problems. You can see this kind of problem every day in your clinic. Well, what today we're gonna talk about some about a women's problem like where's my PowerPoint? Oh, infection is and all those women's problems. But today I'm gonna do something differently. We're gonna do a different approach and with different concepts how we treat diseases. Because if you only focus on the local, on the problem itself, the result sometimes is not very satisfactory because a lot of the things has been taken into consideration. If you ignore all those other part of the body, you just focus on this women's problem like vaginality or by taking some antibiotics or something, sometimes it's not good. we can do it better way and with a better point of view. Today, I'm going to share with you all that. It's very, very important for everybody. And that's what I do every day in my clinic. Whole body has to be taken into consideration. Huh? Okay. So, vaginitis, HPV, yeast infection, whatever. Let's talk about something related and very, very important. Huh? Systemic disease can affect gynecology health through a variety of mechanisms. That's very important. The following are some of the components that can cause gynecological inflammation. So by only taking antibiotics is not a solution. We have to put a lot of things into consideration. Like first is the diabetes. High blood sugar may lead to changes in the vaginal environment, increasing the risk of infection, can trigger gynecological inflammation. So how do we know if the patient has the problem with sugar? Okay. I'm gonna do a little drawing for you. I'm sure we've been talking about diabetes a long time ago, but I'm sure you don't remember. First, always, when I when I start seeing a patient, I always see their palms. I'm not a palm reader, but I can tell a lot of things from the palm. So it's something like this. This area is the liver. So what liver got to do with a women's problem? Oh, we got a lot to do. If this area is red, something like this, I would tell them, hey, your liver is no good. Be careful of what? Sugar. This area is pointing directly to the sugar problem. But that's not the only one. The sugar and is related to liver and stomach. I don't know why, but it's all related in the diamide, in the middle part of the human body. But before when I treat the sugar, if the patient's main demand, the main purpose is for, oh, my sugar is so high, I would do with the stomach and liver treatment. But why they are related to liver, I'm not sure. I just do that, and very effective. So, what about the pulse? The pulse is like this. Right, 顺观尺. The right guan can be very deep and wiry and forceful on the right guan. Deep, 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 deep. And very forceful. The rebound is pretty strong. Then I can tell the patient's sugar must be in a critical condition. So before we treat a women's problem like that, gynecological, we do something with the sugar. How do we do that? We can use the same herbs for sugar and the women's problem at the same time. That's my astringent complex. If you don't know what that is, you can check Tina's the formula book. It's in there. So when we're treating the women's problems, sometimes we deal with the sugar together at the same time by using this very soured and and a little bitter herbs. Together is my astringent complex with good for the sugar and for the women's problem. That's very important. But first, you must know how to decide if there is a sugar problem or not. Majorly, yes. Sugar, the people say, I don't eat sugar, I don't eat much candy, but the carbs are very important. The carbs sometimes can cause more sugar problem than just pure candy or chocolates. Carbs is the major threat to the sugar condition. Huh? So first, we must put this in our mind that women's problem, vaginality or something, can be related to to sugar. So you must, instead of giving herbs to the patient, you must advise them stay away from carbs. Take some sourdough bread, which is 0 sugar, or some gluten-free bread or something to avoid the sugar accumulation. We talked about sugar several weeks ago or something. Sugar, the result is not only the sugar, it's the kidney and heart. All will be damaged by high sugar level. So advising your patient to eat what to eat or what not to eat is part of our job for the treatment. Not just giving, okay, this is herb, go ahead, take it. Or just do needles. You can do needles, whatever you like. But advising the patient what not to eat is very, very important. I've been talking about this, how to maintain health and the concept of health in the past 35 years. I did it in a radio program in Taiwan for 20 years and almost 20 years in USA too, in the radio. But now the what is so popular, the radio, nobody listens to the radio anymore. But that period of experience gave me a lot of a concept. You have to educate your patient, not just only just giving the herbs to go home and take it. It's more important than that, okay? So being as a good doctor, you must advise what to eat or not to eat, huh? Okay. And second, if the lady is very, or the patient is very weak, the autoimmune disease might appear. How do we know the patient has something wrong with it, with his or her immune system? Okay, first, I'm sure you will have all your patients' blood blood sugar, blood pressure, and heartbeat rate taken before entering your room, right? So the blood pressure for the yin deficiency or yang deficiency is low. Simple. Ooh, the lady is like a 95 over 65. The heartbeat rate is 60. That's definitely what? Yang deficiency. And if it's 95 over 65, ooh, the heartbeat rate is fast. Then it's definitely yin deficiency and possible combined with anemia. So in this case, if the patient just, if only taking antibiotics or you're just giving cold medicine to kill all the infection in the female part, no, the result won't be good because her body or his body, and of course, her body can be too weak to digest those cold medicine or become better with those cold destroying medicine. So in this case, we must do something about the autoimmune disease. Like I said, you should advise the patient what to eat or not to eat. So what about the pulse? We've been talking about a lot. Left-hand side, 寸关尺. How to make sure it's autoimmune deficiency is like this. The left guan is very, very weak, almost nothing, no rebound from down below. So if the left guan is so extremely weak and almost disappeared, how could that be? This is nothing but the artery under the skin. So where's the middle section gone? I cannot explain physically, but it just, if the patient is suffering from the autoimmune condition, the left guan is disappeared. Only the rebound from the cun and chi, that's autoimmune. And it always combined with depression. They're very weak. The liver is not only the liver, the organ, is also the immune is depression. And also in my pulsynergy part 2, the left guan also means digestion. So her left one is very, very weak, and means her stomach is very, very weak. So she cannot get nutrition from the food. And maybe because her character is a little bit, off, she might be very picky about her food. I don't eat that. I don't eat that. I want to only eat vegetable. Then all the immune system and body is weak. She cannot digest the antibiotics that's given to her. So we must first, of course, the lady's problem is in here, the left shirt. No matter what, we should strengthen her immune system to be able to fight against those HPV, those virus infection, or bacterial infection, or yeast infection. How do we do that? You have to tell her to eat more red meat. Take zinc, like a 20 milligrams a day, and eat more red meat. Red meat has zinc, protein, and iron. This lady must be anemic. So with all that covered, then if she's taking antibiotics or she will be taking your cold medicine for her vaginal infection, the result will be more satisfactory. So what I'm trying to tell you that is we must know the patient's body type before we give her some medicine to treat her major complaint. Okay? Any questions? No. Good. Oh my God. Hey, Sam. This is from the PowerPoint. So, sorry.
It's PowerPoint?
So have to release,
Yeah, so
erase this.
erase. So you want this, right?
Yeah. Sorry.
Close this out. Go back. You want the patient keep it out? I'm sorry. We share it. Mm-hmm.
Yeah.
In here, right?
The draw.
Draw. Bigger.
Yeah. That's the eraser.
This one?
This one.
This one?
Yeah.
Oh. I cannot do one. Okay, let me share again. Right?
This two.
And I'm going to share this PowerPoint again. Let me use the hammer.
Okay, let's go back to the PowerPoint. Okay, sorry about that. Let me try this one. Okay, so we talk about what we were talking about the autoimmunity, huh? Left one is very, very weak. I'm sure you can take you have learned my pulse diagnosis already, right? And so the finger point, the finger method, there are two of them. Oh, okay, let's do this. This is the artery diameter. So we do take the pulse vertically, like we always do. But now sorry. Usually we take the pulse like this, with our finger bed here to feel the pulse, the diameter and jump, the force of the pulse. And secondly, we should do the vertical skill. Do it vertically, touch the pulse, you will find something different, especially for the immune system. You must use your finger vertically to press the vessel. Now I'm going to share with you a more advanced finger methods is from the side. Usually we talk about from the side approach only on the chi for migraines and the bone spur, sciatica problem, but on the guan, left guan, you should also do this. To feel something, the pulse is aligned like this. I cannot explain. But how come there's another line in addition besides this real artery? There's another one here, and they lie side by side. I cannot explain why, but there is something there that appears mostly on the chi, but on the guan is also, that means the shrink, the shrinkage of the organ. That means the liver blood is so blocked and deficient. Sometimes it's just so weak. You should try to expand it by using my expander or something to deal with that. Okay, so this is how we find out the autoimmune deficiency, especially on the left one. And also, not only the lady will have a female problem because the immune system is so low, this can cause the body's immune system to attack own tissues affecting health, reproductive system. So, besides medicine, more red meat and zinc. Okay. The third one is obesity. You don't need to take a pulse to see that the lady is overweight. So obesity associated with hormone imbalance may increase the risk gynecological and polycystic ovary syndrome. Okay, now this is time for another pulse readings. Okay, this is the normal pulse. And here is the heart 7 pulse, remember? Heart 7 pulse, the right side is yang, the left side is yin. So this is the male hormone. Left side is the female hormone. So whenever a lady feel that her right hand side is so strong, this big S7 is thick and forceful, and we said, hey, you're so bossy. They always laugh. Even the husband will laugh too. So bossy, and actually it means the hormone imbalance, too much male hormone in this lady's body. If the lady is in her 20 or 30 or something, and she's kind of with this obesity, that could be the polycystic syndrome. That means there's a little cyst that will prevent her from ovulation, and it's a major factor for causing infertility. So what about the pulse? There are two things here, polycystic and endometriosis. Okay. This is the left-hand side, Chun, Guan, Shi. The polycystic is like this. Like a little turtle. It's shorter than the width of your fingertip. Just a little turtle there. And if the lady is a little chappy, little hairy, and some darkness in the back of her neck, I always ask her, let me see the back of your neck. Sometimes here too, and in the elbow with some darkness, then it can definitely tell PCOS. And her period is not regular at all. And if you want to have baby, then we have to regulate the pulse in the heart 7. Heart 7, the right-hand side is male hormone, left-hand side is female hormone. We have to reverse it. And for endometriosis, totally different. Endometriosis will be a very thin, wiry lines in the left chi. Like I said, you have to do this. This is the normal artery. You do it vertically. No, you cannot find it. You have to do it from here. From the side in. Here, there can be another very thin, like a guitar. Guitar has 6 strings. This is the thickest, this is the thinnest, smallest. And this one can be very tight, just like a guitar string. So if this happens, the lady is suffering from this endometriosis. That will definitely cause some blockage. And we will say it's cold down there in the pelvic area. Cold means it's extremely constricted. The blood vessel becomes so thin, cannot provide blood to the uterus and other genital organs. So taking antibiotics, no use. And also in this case, sometimes I tell the lady, she said she had a miscarriage several months ago. I said, of course you have a miscarriage, you would, because the blood vessel, this one, is so thin. Your body cannot transfer enough blood to the circulation. How can you nourish the baby? You will have another one if you don't have this fix. So the best formula for this is 少腹足鱼汤. Mara, can you type it? 少腹足鱼汤. To warm it up, to open it up. And for this, you might use resolve lower and breakers or things like that. So if the lady is being a little too chappy, we have to consider this before we focus on the genital infection. Okay? Does this make sense? So they're taking antibiotics or something, didn't work, that's the problem. Huh? Oh, 这是中文的 OK 全身性的疾病也会影响，比如说糖尿病会影响阴道环境的改变，增加感染，所以这个糖是最坏的。糖会造成心脏病跟肾脏病，还有奇奇怪怪的很多末梢的循环的问题，妇科的炎症跟糖绝对有关系，所以可以吃碳水化合物啊。自体免疫就是红斑性狼疮的 lupus and rheumatoid arthritis 都会造成免疫系统自己攻击自己，影响到生殖系统的健康，一定的，自己会自己攻击自己，造成那个发炎。肥胖就不用说了，荷尔蒙失调，而且这种都是荷尔蒙失调，这个也算是一种荷尔蒙失调啊。Okay, the number 4 is a kidney disease. Renal insufficiency can affect electrolytes, balance, and the immune system throughout the body, increase the risk of infection, and affect gynecological health. Absolutely. But the kidney is a real kidney, not the kidney we're talking about. In Chinese medicine, it's different. In Chinese medicine, kidney means sex hormone or adrenal, something like that. This kidney is the real kidney. The real kidney. About the immune system, we were talking about just a few minutes ago, the autoimmune, something like this. The left one is so weak and disappeared. But also this one can be another part of a immune system, which is too much. The left one, very forceful. Sometimes I'll tell, oh, your immune system is too strong, so you attack yourself. And definitely, from the perspective of the emotional angle, this is depression, this is stress. Stress means this lady is very active and will hurt other people. This one is more inward. The treatment for this, we might use, like I said, I treat patient problem as with the mechanically. In this case, we have to drop it down by using astringent or liver detox or even 加味逍遥散. In this case, weakness, we tonify it with 人参养荣汤, even 十全大补, or even 补中益气 to live it up. Come on, eat more red meat, huh? And then after putting this into consideration, we will start treating the female's problem, huh?